Hello everyone, welcome back to Microbiome Solutions. Today we are going to discuss about the screening as well as the confirmatory test used in diagnosing HIV infection. The diagnosis of HIV infection can be done by three major types of available tests, and the tests include antibody test, that is detecting the presence of antibody in the patient's serum, and combination of antigen and antibody test, nucleic acid amplification test based on PCR. As I told earlier, diagnosis of HIV is divided into screening test and confirmatory test. Screening tests possess high sensitivity and have a broadly reactive spectrum, also are simple to perform. They are not highly specific and there is a chance that they might give a false positive result. Initial screening tests are performed using whole viral lysate as the target antigens using enzyme-linked immunosorbent assay. So, the screening test done for the identification of HIV is ELISA or enzyme-linked immunosorbent assay. ELISA test screens for the presence of antibody in the patient's serum. Antibodies are detected in the patient about 3 to 12 weeks after exposure or after infection with HIV virus. This test has a high level of sensitivity, but there is a chance that they can cause false positive test result. So that all the positive ELISA tests must be confirmed with the confirmatory test. And the direct solid phase antiglobulin ELISA, that is the type or method most commonly employed in screening the HIV patient. The antigen is obtained from HIV grown in continuous T lymphocyte cell line, or it can also be prepared by using recombinant DNA techniques. This antigen should represent all groups and subtypes of HIV-1 and HIV-2. So while performing the test, the antigen will be coated on the microtiter well or a suitable solid surface, and to which the test serum will be added. If the patient's serum is having antibody, it will bind to the antigen which is already coated onto the microtiter well, so that there will be antigen and antibody complex formation. The next step in ELISA is washing away of the unbound serum. After washing, anti-human immunoglobulin linked to a suitable enzyme is added to this antigen antibody complex. And the addition of this enzyme will enhance the bond between antigen and antibody, and which will be followed by the addition of a substrate. Substrate is a material which gives color to the test. So if the test serum contains anti-HIV antibodies, a photometrically detectable color is formed and which can be read by ELISA readers. While ELISA is ideal for screening several samples at a time, and it is inconvenient for testing single samples quickly. So, FDA has also approved several rapid HIV antibody tests that can be performed in 30 minutes and can help to overcome some of the barriers to early diagnosis. So if you're having one sample in your clinic and you need to get it tested for HIV, you don't have to wait or you don't have to perform an ELISA test. Based on FDA, they have approved that rapid HIV antibody test can also be performed as a screening test, which gives us a result in 30 minutes. If the rapid test or the ELISA test is giving you a positive result, you have to go for a confirmatory test. This screening test use oral swabs or blood and are interpreted visually and require no instrumentation. If it is a screening test based on immunochromatography. And the rapid test usually work on the principle of immunochromatography. HIV rapid test screen for HIV antibodies requires no instrumentation, but it requires confirmation. In this rapid test, HIV antigens are affixed to the test membrane. You have a test membrane with an absorbent material where the HIV antigens are affixed. And if the patient's serum is having HIV antibody, they will bind to the affixed antigen to form an antigen-antibody complex. Thus, a colorimetric reagent provided in the test kit, will bind to this antigen-antibody complex and gives a visually detectable color. And the confirmatory test for diagnosing the HIV, if a screening test is giving you a positive result, you have to always go for a confirmatory test before reporting it as positive. So the confirmatory test in HIV diagnosis is Western blot analysis. In this test, detects the antibodies to specific HIV proteins. Here, HIV proteins are separated by using electrophoresis technique based on the molecular weight of that protein. So once they are separated using electrophoresis, they will be blotted onto a strip of nitrocellulose paper. And these nitrocellulose papers are made to react with test sera with enzyme conjugated anti-human globulin. So first we need to separate the HIV protein based on their molecular weight using electrophoresis technique, and the separated proteins will be blotted onto a nitrocellulose paper strip. This strip with the HIV proteins will be made to react with the test serum which may have HIV antibodies, and the test serum plus strips will be reacted with the enzyme conjugated anti-human globulin, and a prominent color band is produced after the addition of a suitable substrate to this nitrocellulose paper, and the sera from infected patients who have antibodies to HIV which will react with the envelope glycoproteins, core proteins, or both of HIV virus. So when you are running a electrophoresis, positive and negative control should be run parallelly to allow the identification of viral proteins. So in this picture, you will be able to see different HIV proteins separated by using electrophoresis and which are labeled onto a nitrocellulose paper. These are the HIV proteins GP160, GP120, P66, GP41, P31 and P24. This is a control nitrocellulose paper, and here you have a positive nitrocellulose paper and a negative nitrocellulose paper. You have to always compare with the control, that of positive and negative. We can see in control there are different HIV proteins, wherein in the negative strip there is no proteins, and you can see in positive there is a band, the location of P31, P66, GP120 and GP160, which gives you an idea that the patient with this test serum is having GP160, GP120, P66 and P31 proteins, their serum. So the position of the band on the strip indicates the antigen with which the antibody has reacted in a positive serum, and the bands will be seen with multiple protein antigens, typically seen with P24, P31, GP41, GP120 or GP160. So if you want to have a specific and highly sensitive test result, you should always go for a combination of ELISA and Western blot. This combination of ELISA and Western blot gives us a high degree of specificity to our test, but The antibody is detectable by these procedures only in the first 3 to 12 weeks after the infection with HIV virus. This period is called as window period, and 97% of infected people are likely to develop antibody during this period. And if a suspected individual test is negative during the window period, you should remember that the test should be repeated 3 months after the exposure, because during the window period there is a chance that we might miss the antibodies. During the window period, the individual can still transmit the infection to others by sexual contact or even by blood donation. Therefore, nucleic acid test is performed for blood transfusion, and it is mandatory that you have to perform a nucleic acid test before blood transfusion. That is about today's class. If you have any doubts, please post it in the comment section, and please do like, share and subscribe to our channel. Thanks for listening.